Hi, my name is Jen Amos. I am the president and CEO of Encounter Telehealth. We provide behavioral health care to underserved communities throughout the Midwest and Mountain States via telehealth. We contract with long-term care facilities, mainly skilled nursing facilities, also hospitals and health clinics to provide care for their patients in need. We also own and operate a clinic in Western Nebraska where we treat adults and adolescents with severe mental illness. Now, I know this will be no surprise to you, but we have a national crisis in our hands when it comes to behavioral health care. 65 million Americans suffer from a diagnosable mental health illness. That is 1 in 4. Yet we have less than half of the psychiatric specialists that we need to meet that demand. And when you look at psychiatrists, they are the second oldest practicing group of MDs, nearing retirement, and their numbers continue to dwindle. So how are we solving this problem? Well, we remove those geographical barriers through technology, telehealth. We have a national network of board-certified psychiatric mental health nurse practitioners who, over our telehealth platform, are able to connect with their patients wherever they may be. We currently operate in full practice states, so our nurse practitioners are able to diagnose, treat, and prescribe without MD supervision. Now, before I talk more about Encounter, I would like to give just a broad overview of telehealth in general. Now, it clearly improves access to care by removing those geographical barriers I mentioned earlier. It also reduces costs. We have a very large underserved community here in this state as well as throughout the country, where there are very few healthcare providers and practically no specialists. We really need to use telehealth to overcome these difficulties. And there are 4 main technologies or applications for telehealth today. Video conferencing, which is what we use in behavioral health care, store and forward, mHealth, mobile health, and remote patient monitoring. Video conferencing, as I mentioned, for behavioral health care has shown great efficacy for the delivery of care in that specialty area. Store and forward is really delivery of medical data from one provider to another. Dermatology would be a good example of this. Say an image of a skin condition would be sent to a specialist across the country. mHealth is really a Fitbit or an application on your smartphone that it empowers you to really manage your own health care. And remote patient monitoring, which is the primarily in-home monitoring of an individual's vital signs. This is excellent for individuals who are just discharged from the hospital or those who have a chronic condition and need to be monitoring daily those vitals. It really helps catch complications early and also provides more in-depth data on that individual. These technologies are all creating vast opportunity in healthcare, the delivery of healthcare, and empowering providers to take control and ownership of their own schedules. So back to Encounter Telehealth. How do we work? Well, as I said, we have a network of board-certified psychiatric mental health nurse practitioners. They're all over the country. They work with us as independent contractors, and they're paid based on their billable hours. It's by CPT code. We really think of ourselves as your private practice. We do all the administrative work, the billing, the compliance, the scheduling, the patient intake. We do all the business development and sales, contracting with those long-term care facilities to provide care for their patients and residents, and also the IT, the software, hardware, and even a dedicated IT support team. The use of telehealth will only continue to grow and to solve these problems of accessibility to healthcare. And it will only continue to empower the provider to really set their own schedule to work from wherever they choose, whether it's their home office or their own small practice. I encourage you all to really explore telehealth as an opportunity for you as you go and start your career in this space. And I'm happy to talk to any of you about this in more detail, whether you want to talk about Encounter specifically or telehealth in general. Randy has my contact information, so please do get in touch with me. I'd love to hear from you. I wish you the best, and you've really picked a very smart path to go down.